Module 5, Financial Facts of Transplant. The information in this module will be pretty simple because each individual will likely have different forms of insurance coverage. However, all patients must have health insurance in order to proceed with the evaluation. You will meet with your financial coordinator during your Visit 1 appointment, who will help you understand what your financial situation is. However, it is important to know now that getting a transplant is very expensive, and having Medicare alone is not enough. You will need a supplemental insurance to help cover the costs. Also, there will be out-of-pocket costs that you will have to pay for your medications after your surgery. Medicare will only pay for your anti-rejection medications for 3 years after your surgery. After that time, Medicare will take you off the disability list and you will no longer be able to get funding for your medications. Besides Medicare with a supplement, full main care and private insurance will normally cover your transplant. Again, the financial coordinator will check in with you to make sure your coverage is acceptable. The two big insurances that won't cover a transplant include MMC Free Care and the VA, Veterans Association. Remember that even with insurance, transplantation requires out-of-pocket costs. Keep in mind that gas for transportation to and from Portland, the need for childcare, or the need to have family members or friends spend the night in a hotel during your surgery and recovery, that will not be covered by any insurance. Also remember that you will have to pay for a significant portion of the costs for your lifelong anti-rejection medications. To help pay for these extra costs, start thinking about fundraising. Other patients in the past have used sites such as GoFundMe, but keep in mind that some of the money you raise must be paid to the government if you are using an online site. Your financial coordinator will tell you about more transplant-specific fundraising sites during your Visit 1, so make sure to come with any questions if you are considering fundraising. These sites include the National Foundation for Transplant and the National Living Donor Assistance Center. This site helps fund the traveling costs for a living donor. If you or your living donor are worried about financing the donor surgery and recovery, your insurance as the recipient, combined with the transplant program, will cover all direct donor costs. Therefore, the donor does not have to pay a cent for the surgery, hospital stay, or follow-up care in case there are complications. However, if you think traveling will be an obstacle that may prevent someone from donating to you, make sure to check out the National Donor Assistance Center online. You can see if you and your donor qualify to have transportation funds. However, keep in mind that you must immediately return your application if you hope to be approved. You're all done with these modules. Please complete the last survey and hang in there until you see us for your Visit 1 appointment, which should be scheduled very soon. Thank you for taking the time to educate yourself and to listen to these past 5 modules. Here's a list of other online resources that you can use if you want to learn more about transplantation. Just copy and paste the links and explore the websites. Thank you.